Are you tired of grappling with the mystery of your knee pain, desperately seeking relief? Well, you're not alone. Knee pain can impact our daily lives, from the morning jogs to climbing stairs. So in this video, we are revealing the top 10 types of knee pain, their cryptic symptoms, and most importantly, providing you with the solutions your knees have been begging for. By the way, this list is from least common to the most, so keep watching. Let's dive into it. Number 10 on our list is Patellofemoral Pain Syndrome, also known as runner's knee. This condition is characterized by pain around or behind the kneecap, especially during activities like running or climbing stairs. According to doctors, factors like muscle imbalances, overuse, and improper alignment may contribute to this type of knee pain. Coming in at number 9, we have IT band syndrome. This pain typically presents on the outer side of the knee and is common among runners. Symptoms include sharp or burning sensation. Doctors often recommend addressing muscle imbalances, stretching, and modifying training routines to alleviate IT band syndrome. Next up at number 8 is the meniscus tear. This involves damage to the cartilage that cushions the knee joint. Symptoms may include pain, swelling, and limited range of motion. Doctors emphasize the importance of rest, physical therapy, and in some cases, surgical intervention for severe tears. In the 7th spot, we have ACL injuries, commonly seen in athletes involved in high-impact sports. An anterior cruciate ligament, or ACL tear, can result in instability, swelling, and intense pain. Doctors often recommend surgical reconstruction followed by rigorous rehabilitation for a full recovery. Now at number 6, let's talk about osteoarthritis. This is the degenerative joint condition that can lead to knee pain, stiffness, and reduced mobility. Doctors emphasize lifestyle changes, weight management, and sometimes medications to manage symptoms and slow down the progression of osteoarthritis. By the way, if you want to reduce your knee pain with a simple method in your home, don't forget to click the first link in the description. Taking the 5th spot is rheumatoid arthritis, an autoimmune disorder that can affect the knees. Symptoms include joint pain, swelling, and stiffness. Doctors often prescribe medication to manage inflammation and recommend lifestyle changes to support overall joint health. At number 4, we have bursitis, which involves inflammation of the bursae, small sacs filled with fluid that cushion the knee joint. Symptoms include pain and swelling. Doctors may recommend rest, ice, compression, and elevation, along with anti-inflammatory medications. Coming in at number 3 is gout, a form of arthritis caused by the buildup of uric acid crystals in the joints, including the knee. Symptoms include sudden, severe pain, swelling, and redness. Doctors typically advise lifestyle changes and medication to manage gout flare-ups. Number 2 on our list is tendonitis, which involves inflammation of the tendons around the knee. This can result from overuse of repetitive stress, and symptoms include pain, swelling, and stiffness. Doctors recommend rest, physical therapy, and in some cases, anti-inflammatory medications. And finally, taking on the number 1 spot is patellar tendonitis, also known as jumper's knee. This condition involves inflammation of the patellar tendon, causing pain just below the kneecap. Doctors recommend rest, strengthening exercises, and addressing biomechanical issues to manage this type of knee pain. That's it, folks. Don't forget to subscribe, and thanks for watching.